everyone, welcome back to my channel. If this is your first time joining us, welcome. We are continuing our series called Newborn Knowledge, where we'll be discussing choices that you have at birth for your newborn. In our first video, I shared about vitamin K and your choice about giving vitamin K to your child or not. And today I'll be continuing this segment with talking about your option to delay cord clamping or not. So to start off, what is delayed cord clamping? So, as the name indicates, it is delaying clamping the umbilical cord that connects the baby to the placenta at birth. So this is how the baby's been getting nutrients during their entire pregnancy. So you might be thinking, pregnancy's over, Leslie. Why does it matter when we cut the umbilical cord? Well, there are some benefits. This does allow for additional blood to get from the placenta to the baby, increasing the blood volume by up to a third. That is a good amount of blood. But why does it matter? Well, this additional blood means that the child gets additional iron, and iron is very, very good for brain development. So it is good for your child to delay the cord clamping if possible. Well, you might be asking, who has this option and how does it work? If you have a vaginal birth and your child is born without complications, breathing fine, and doesn't immediately need to be taken for any reason by the doctor to be checked out, then you can choose to delay cord clamping. Delayed cord clamping can vary in terms of time, but the rule of thumb is normally to wait until the cord stops pulsing so that you know that all the blood has been transmitted. That normally, I've seen that range. People say normally about 5 minutes, but you can keep the cord connected longer. So you'll see what they do is that they clamp the cord. That stops the flow of anything from placenta to baby, and then they'll go ahead and tell you and offer whoever would like to cut the umbilical cord for the baby. So the delayed cord clamping does just specifically have to do with when they put the clamp down, not so much when you cut it, although normally they clamp it and have you cut it right away. Just so you understand, it's a two-part thing there. And then so you may be asking, are there any risks to delayed cord clamping? Again, there were none that I could find in my research or from when I spoke with my health provider. But again, if the child does need to be immediately attended to, this won't be an option for parents. So you don't need to imagine that it could be a risk, because if it were a risk, they wouldn't allow you to do it. But again, speak to your healthcare provider about delayed cord clamping to see if it's an option for you. While you're at it, go ahead and ask about skin to skin. This is another option that you have at birth. This is a sweet time for the mother and the baby to be able to bond, and it is another option that you have. So, often when your child is born, sometimes a lot of things are going on, and they're taken to be weighed, to be taken their height, to be given any shots, to be bathed, all of this stuff, and it's a lot. You just gave birth. Just know that you also have the option to delay all of that stuff. If the child is not in any danger and doesn't need to be specifically taken to the NICU or to be attended to by a doctor, then you do have the option to ask for that other stuff to wait. And I say this because I'm not sure that everyone knows that it's an option, but it is. So just know your rights as a parent, that you can choose to say, I'd like to hold off on bathing my child. I'd like to hold off on taking the weight. I'd like to hold off on doing all of those things just a little bit for me to have some time with my child. And you are totally allowed to do that. And so just know that that is a choice that you have. So again, if if you want to talk more about if this is an option for you, what it looks like wherever you're having your child, in a birth center, a hospital, at home, wherever you choose to have your child, then I'd say go ahead and speak to your healthcare provider. I just want to make sure that you remember, and this is my goal with these videos, is that you are informed about all of your options so you can make the best choice for you and your baby. So thank you so much for joining me as I shared about delayed cord clamping today. If you liked this video and found it helpful, please hit the thumbs up button. And to get alerted when a new video comes out, feel free to subscribe and hit the notification button. If you'd like to see more in my newborn knowledge and you have any specific topics you'd like to see me covered, please leave a comment down below. Also, if you have any additional questions, feel free to leave those there as well, and I will try to get to those as soon as possible. Until next time, thanks so much for joining me. Bye.